After 5 years of construction, Enloe Medical Center's new patient tower stands ready for viewing. Over 3,000 community members attended Saturday's grand opening and community health fair. Enloe staff gave free health screenings and information and guided tours throughout the new building. The Magnolia Tower is part of the Century Project and helps Enloe meet California's seismic requirements and the needs of an ever-growing region.
Enloe Medical Center is one of only 2 Level 2 trauma centers in Northern California. We've got a huge geography that we take care of.
Not only are we expanding to meet the needs of Chico, we're expanding to meet the needs of a 6-county area of about 400,000 residents.
The Magnolia Tower features state-of-the-art medical technology.
Technology has changed rapidly within surgery, so we now have a system, it's actually called Black Diamond, where all of the equipment, and specifically video equipment, in our operating room is fully integrated. The lighting, the video equipment. If we need a radiologist or other physician specialist to consult, they can do it real time during the surgery, and they can see the images in another part of the hospital at the very same time that it's happening in the operating room.
The expansion adds 191,000 square feet, doubling the size of the medical center, and 144 new private patient rooms.
We will be going from semi-private to all private rooms.
The Magnolia Tower has 5 dedicated floors, including the Nettleton Mother and Baby Care Center.
Parents are able to go in and have private areas. It's not an open area. We actually have individual care units, rooms for our babies that need that higher level of care.
Each floor has a lounge. Each room has a TV, thermostat, bathroom, and furniture for families to stay the night.
The rooms are very spacey. They made it family friendly.
The heating, ventilation, and air conditioning system, the safety systems, everything from the flooring to the acoustical ceiling, all those things really combine to help make this a very pleasant environment.
The tower also has a meditation room, a lobby that looks like an art gallery, exclusive elevators for patients, and an upper crust bakery cafe coming soon. Many touring community members commented that this does not look or feel like the average hospital.
Really, I mean, with the technology, you see it, but it's very relaxing in here.
One thing that definitely stood out to me was the color schemes on every floor. It didn't feel like we were walking through a hospital. There were pretty blues and greens, and the artwork on the walls was amazing. Even the hardwood floors in every room just gave it a little bit more personal touch.
Enloe staff says the hotel-like atmosphere is holistic.
You're stressed enough when you come into a hospital. You're not at ease. So we want to do everything we can to lessen that tension.
When we get real crowded, it's not really conducive to reducing stress. And this is what we're trying to attain here with private rooms, a quieter environment, a better work environment for the staff that are here. Hopefully all that will help combine to ensure that our patients have a pleasant stay here, but also a productive one where they actually are able to get better and feel good sooner.
From the technology to the colors on the walls, everything in this new building is centered around the patients and their families.
Sometimes hospitals are constructed for ease of the caregiver, ease of the physician or nurse. We wanted to design a hospital that was here for the ease of the patient.
Even these ICU rooms were designed with greater visitation in mind.
Most ICUs still in the United States have pretty stringent visitation. And that doesn't work for a lot of patients, and it really doesn't work for a lot of family members. We developed a plan whereby the visitation would be driven by the patient instead of being driven by, outside forces.
It's not just about the building, it's about the people who work here. But what the building does provide is that people have been really excited about it. The fact that we do have new technology to offer, that we have been able to create a different kind of healing space.
We were walking on the tour, and everyone that was giving a tour just looked so happy and excited for the building to be open. So I think that will translate into the care that they are giving patients here when the building actually opens.
This is the standard that we're setting, so we're trying to create the same environment throughout the campus.
Next, Enloe plans to open a new surgery center, remodel the 5th Avenue Tower, build a park, and build a new emergency room.
Our emergency room was built to handle about 15,000 visits a year, we now have 40,000 emergency room visits a year. So once this new tower is finished, we will actually triple the size of our emergency rooms.
The entire Enloe Century project is expected to cost $175 million and is funded by savings, bonds, and donations. Enloe is a nonprofit hospital. No taxpayer dollars are used.
The community's been tremendous. The local neighborhood here had to put up with all the construction for 5 years or 6 years, and they've been very supportive.
Although the public has previewed the Magnolia Tower, Enloe is not finished yet. After inspection, licensing, equipment installation, and staff training, the building will admit patients in the fall.
If I ever did need care here, I know I would be in good hands.
This building, I think, signals our capability and our capacity to be here for many years to come.
Angelica Waddell, Examiner.